Hi there, welcome to the Animals Naturally podcast with me, Suzanne. I'm founder of Taranet, a leading international natural animal healthcare website at taranet.co.uk, where you can find lots of information on how to care for your animal holistically, whether they're large or small, plus training, advice and information on a variety of topics to help you develop your own animal care business, as well as online shops for aloe vera products for people and animals, and my doTERRA essential oils range. So in this episode of the podcast, I'm going to talk about dogs, and in particular, how you can tell if your dog is in pain. So what would you look for if your dog is in pain? Well, every dog is different, so there's not a definitive list of symptoms that you'll know for sure your dog is in pain, and obviously you know your dog best. But common signs can include your dog not like being touched. For instance, they don't like being groomed or stroked. They may be reluctant to exercise, particularly where they used to enjoy exercising and now they're perhaps more reticent. They may have a change in behaviour, so they could be more quiet than usual, or they could even be growling and barking. Their eyes may not be sparkling and bright. They may appear more soulful and just look a bit more down. They may be panting more than usual, particularly if it's not even very hot or they've not overexerted themselves. They may be panting even at rest slightly. They may appear lame. They may not want to lift their leg up to urinate or not be able to stay still to go to the toilet, so they're going to the toilet on the move. They may have a change in eating and drinking habits. As you know your dog best, you will know what is normal and healthy behaviour and notice any changes. But likewise, as we do see our animals every day, it may be that we overlook symptoms and don't see it. So it's a good idea just to look at your dog through a fresh pair of eyes if you can, every so often, every few days or every week or whatever, just to see if they do seem their best. For example, if you notice your dog starting to overchew or drop food, that can be a sign of dental problems. They may have a toothache, for instance, or gums may feel sore. Obviously, as animals age, their behaviours can change, and that doesn't necessarily mean they're in pain. But on the other hand, don't assume that reluctance to exercise is just because your dog is older. He or she may have arthritis or some other health issue, which is causing them to feel discomfort. Dogs are very good at keeping their pain hidden and can put up with a lot. Obviously, they can't tell us if they're in pain directly by saying, "Hey, mum or dad, I don't feel very well." So it's up to us to notice. So if you do notice a change, do get to a qualified veterinary surgeon for advice as soon as possible. And I do highly recommend that. Obviously, I have a website on complementary animal therapies, and I'm talking to you now on this podcast about dog pain, but I haven't seen your dog. I'm not a qualified veterinarian. It's important you don't just take internet advice and advice from family or friends, no matter how well-meaning people are. Unless somebody is a qualified veterinarian, they're not in a position to actually tell if your dog has a health issue. And likewise as well, it's important that a veterinarian sees your dog face to face so that they can actually tell, because it's difficult to tell just by looking at video calls and on the phone. So if you're worried, do seek a veterinary surgeon's opinion. So if you go to the vet, what do you might expect to have to happen? Well, they will give your dog an examination. It should be quite a thorough examination. It may even require a variety of tests to see what the cause of the issue is, and it may take some time to find out what's wrong. Your veterinarian will be able to advise on a course of treatment, including pain relief. So, can complementary therapies help if your dog is in pain? Yes, they can, and many types of therapies can help relieve pain. These can include massage, acupuncture, physiotherapy, osteopathy, chiropractic, homeopathy and herbal remedies, plus many others. But before you try any therapies, a veterinary surgeon should diagnose your dog to avoid any delay in the correct treatment, as different therapies, like with conventional medicine, will require different complementary therapies and dosages. So what might you expect if your animal does need a complementary therapy, or if you're interested in pursuing that line? Well, acupuncture is a good place to start. It's worth knowing, though, acupuncture should only be carried out on an animal by a qualified veterinarian. Many veterinary surgeons have taken further training in acupuncture, so they are well versed in understanding what exactly to do. Acupuncture is a system of healing which has been practiced for thousands of years, and it's been gaining increased popularity in veterinary medicine over the past century. Acupuncture is just one approach of traditional Chinese veterinary medicine, and it can help by basically working on the concept of the body having meridians or energy lines running along it. And when the body is out of balance, the energy lines are blocked or deficient in some way. The use of thin sterile needles, sorry, I've got a tongue twist there, at appropriate acupuncture points will rebalance or redirect this energy and balance the body. So the ailment being treated will mean different acupuncture points are used depending on the animal and its needs. And it works by the acupoint being stimulated through the application of the needle, and that in turn can help relieve pain and inflammation. That's a really good example of how one complementary therapy can be used to help if your dog is in pain by really taking a targeted approach. And as I said, that will be carried out by a qualified veterinarian who understands and has been fully trained in the use of acupuncture with animals. So to recap then, your dog will have a variety of signs that they're in pain, or maybe only one. You may notice, say they're not eating very well, they're not eating properly, or dropping their food. That might in itself be the only way you know they've got a dental problem, or another issue as well. It may be something else that's caused them to feel have less of an appetite. They may say not be keen on jumping up in and out of the car. They may just seem more reluctant to exercise so far. It could be a whole variety of reasons. So it's important to look out for the little things. Don't expect it to be necessarily a whole raft of different symptoms. You know your dog best, so you'll know what is normal and healthy. But as I said earlier, do take time to take stock of your dog. Try to look through a fresh pair of eyes, particularly if you've got a few concerns. It's easy when we're busy. We're obviously working or doing many other tasks or hobbies or whatever it might be, and not necessarily always having the time to really think about what our dog is actually doing. That can happen. Life can get in the way. So do take time to take stock of whether your dog is his or her normal self. If you'd like information on complementary therapies for your animal and how different therapies, what they are and how they can help, then do please look at my website at taranet.co.uk, where you'll also find a natural pet health blog, which has got lots of different posts with information on how to care for your animal holistically, as well as the main directory at my website. I hope you found that useful, and I've got some ideas to tell if your dog is in pain and some of the things that you could try. As I said, do speak to a veterinarian, and if you're interested in a complementary therapy approach, then there's many different therapies that can help. So look at my website at taranet.co.uk for some information. I hope that's been useful, and until next time, goodbye.